Hello, everyone, and welcome. My name is Ellie Zambrano. I'm the Executive Director at the Center for Innovation in Social Work and Health at the BU School of Social Work. First, I want to thank you all for taking the time to join us this afternoon, both in person, and we have attendees on Zoom for our Hubie Jones Urban Health Lecture. We have over 290 people registered for today's event across 26 states and also Quebec, Canada. So thank you again. Today's event, Transforming Health Through Urban Leadership, featuring Massachusetts State Representative Jons Santiago, addresses the social determinants of health and how they expose inequities in our healthcare systems. We'll explore how physicians and social workers are positioned to inform legislation to address these inequities. By taking an intersectional approach to health that includes social workers, we can build a better system that is grounded in equity and social justice. With that, I want to thank the group of students that are here today through BU School of Social Work votes. Their commitment to voter registration and civic health engagement is a wonderful example of how we can all make a difference. Our goal at the center is to provoke thought and stimulate action consistent with our mission to improve health outcomes, population health, health equity, social justice, and expand the impact of social work in health. We define health in broad terms, consistent with the World Health Organization, including physical, mental, and social well-being, and to involve work at the individual, family, community, institutional, and societal levels. To get started today with our program, I'd like to first introduce Jorge Delva, Dean of Boston University School of Social Work and Director, and Paul Farmer, Professor for the Center for Innovation in Social Work and Health. Thank you.
Thank you, Ellie. Thank you, everyone, for joining us today. This is the 10th anniversary of the Hubie Jones Urban Lecture. What a wonderful milestone, 10th year. And how nice it is to be able to have people in person, right? This annual symposium is focused on examining vexing health issues, featuring national and international leaders working at the intersection of health and social justice. The lecture series was established in 2012 by an anonymous donor to honor the vision of Hubie Jones, Dean Emeritus and former Dean of the School of Social Work from 1977 to 1993. I'd like to say hello to Hubie, who's joining us via Zoom. Hubie has helped shape Boston's civic landscape for over 45 years, playing an integral role in community organizing throughout Boston and within the city's African-American population. I'd also like to take a moment to reflect and celebrate the life of the presenter, of original presenter in 2012, Dr. Paul Farmer, who passed away tragically this past February. Dr. Farmer, an advisory board member for the Center for Innovation in Social Work and Health, is a pioneer in fighting for health equity, helped guide our work on global health equity in the US and internationally. I know he incredibly important work that it has highlighted. Before we begin with today's presentation, let's review a few events details. Representative Santiago will speak between 30 to then we will have time for audience questions, both in person. For those on Zoom, please type your questions into the Ellie Zambrano will share with the speaker and will take as many as time allows. If you are a social worker needing continuing education credits for this event, you will receive a link in your email after the event to a quiz that you must complete to receive the continuing education credits. This event is also being recorded and will be available on our website, www.ciswh.org. For today's speaker, Massachusetts State Representative John Santiago, service to others is what drives him. As an ER doctor at Boston Medical Center, a former volunteer in the Peace Corps and captain of the U.S. Army Reserves, Representative Santiago's life has been focused on serving his community. He's taken these experiences to Beacon Hill and now advocates for Boston as a state representative. As a state representative in the Massachusetts legislature, he has fought to address health disparities and combat the opioid epidemic, helped to preserve and expand affordable housing, and work to pass a once-in-a-generation education reform bill. He is proud to have been a leader in one of the most productive and progressive legislative sessions in recent century. Please welcome State Representative John Santiago.
Good evening, everyone. It's great to be here with each and every one of you. Very thankful and honored to be given this lecture, the 10th year. Thank you for the kind introduction, Dean Delva. Ellie, thank you for organizing this. We've been texting, emailing, and you've been fantastic. And thank you to the School of Social Work for the invitation. It's particularly, I'm particularly honored that Paul Farmer gave the first lecture. Now, before we start the presentation, I just want to quickly mention that a lot of what I do stems from reading his work. And I'm recalling reading his books when I was in my early 20s, I think Infections and Inequalities, Pathologies of Power, I believe, a book that he wrote about the Haitian Haiti history, which really moved me as a young person and pushed me to serve folks across the globe, spent 5 years abroad, and coming back to the States, to Boston, to continue my work here. So really honored to be here and looking forward to sharing this presentation with you entitled The Political Determinants of Health, Lessons from the Front Lines. And when Ellie and I spoke about the topic of the presentation, I think initially it was really going to be focused on the social determinants of health, which I think many of us in this room and virtually are familiar with. But over the course of the past 2 months, I read this new book, and it was entitled The Political Determinants of Health. And I was like, wow, that's what I've been feeling and going through for the past couple of years. And it's essentially followed my trajectory. And so I felt like I had to change things up and talk about it. So my hope today is that I leave you with the sense that all what we do, whether it's at the individual level, helping patient or client one at a time, or what we do at the social determinant of health level, it's really underpinned by politics and policy. And that if we're not getting active in those spheres of influence, we're not doing enough, and that we can do more and we should do more. So a couple of disclosures. There are 0 financial disclosures to state. Secondly, I'm a registered Democrat. Now I say that because, you're supposed to put your political affiliations on these types of things, but this is a nonpartisan talk, right? I don't practice medicine. I don't go about policy with respect to how I believe we should or should not be doing. I practice medicine and I practice policy, really stemming from my background as a physician and as someone I grew up with, and the lessons I learned in my community. And the idea that what impacts our lives really comes from the community, right? And sometimes politically, whether at the State House, or in the community, you might be approached by certain people who don't believe like that. They believe more that it's up to the individual, that it's up to choice. But the fact is that no one, decides to be poor when they're born, or to grow up in a food desert, or to grow up in a neighborhood full of violence. And so my talk and some of my points are really reflected on, my background and kind of those underpinnings. Last real disclosure is that I just became a new father. This is Raphael. He is 5 weeks old. He has been up with me doing some PowerPointing and some reading in the middle of the night, and he's really been such a joy, and he's growing incredibly fast. So I was just with him an hour ago, giving him a tour of the State House for the first time. but he sends his regards. And before we really get started, I just want to spend a quick second to pay homage to Hubie Jons, who is listening virtually. Mr. Jons, we haven't met yet, but I do look forward to meeting you in person soon. But I want to recognize and reflect upon the fact that we are here standing on the shoulders of people who came before us, particularly people who have put the work in their community. And just reading about his work and his background from New York to Boston, his work in child wellness, and his ability to work at different intersections, academia, policy. I mean, that's the work that we strive to do. And so I'm really honored to be here. And if you have a second, you should all check out historymakers.com. And there is a collection of interviews with Hubie Jons. And I think it'd be worth your time to listen and learn. Because I think he cared about what we all care about here, and it's equity, and particularly health equity. And it's a story that maybe I wasn't necessarily able to talk about in academic terms, but it's something I felt as a young person growing up in urban America, being Puerto Rican, witnessing my uncle become infected with HIV, and he ultimately died of AIDS, being a stone throw away from some of the best hospitals in the world. And so how does this happen to my uncle? And I think as a young person, you begin to realize that this is unfair, this is not right. And something is going on because these patterns are consistent and they're pervasive. The fact that my uncle passed away, leaving his son, my cousin, to essentially become an AIDS orphan. And as a result, that created a whole host of challenges for my family and my cousin, and which have lasted for decades. But it was those lessons that I saw as a young person, a kid really, that really inspired me to get involved in health equity. And I completely agree with Dr. Martin Luther King here, who says, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think it's because so many things funnel down to healthcare, right? When we talk about racial injustice or economic injustice, that will ultimately funnel down to what I see in the emergency department each and every day. Because when I work, which is the busiest ER in New England, it's a safety net hospital. The vast majority of my patients are Mass Health, Medicaid, Black and Brown, poor immigrants, don't speak English as a first language. They're suffering from a whole host of different injustices that have been intentionally put there, purposely, but that funnel down and impact their health. So what is health equity? I kind of gave you my origin story, so to speak, and how I came aware of the term as a young person growing up in Boston and with my family and my uncle. But let's talk about the definition here. And this is the Robert Wood Johnson Foundation definition. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And that requires the active removal of certain obstacles, things like poverty and discrimination, and things related to that, right? If you have access to a good job, education, a safe environment, that drives equity. But I want you to pay attention to a couple of terms here, fair and just, right? There's a moral imperative here. And it's about addressing and rectifying things that have been put in front of people's or certain groups' path. So you have to actively remove these obstacles. I think many of us have become familiar with this picture over the years when we decide what is equality and what is equity, right? I mean, you look at this picture on the left as equality, and that's essentially giving the same number of resources to a certain group or person. But it doesn't really address what's going on here. The young kid in the purple still can't see, what was he impacted by? Maybe he was living in a food desert, couldn't grow appropriately. Maybe there's a wall in front of him that has been some sort of structural, institutional barrier to being able to view the game. So equity is really about being active and removing those obstacles. And that's what we're tasked to do, not just as physicians or social workers, but as elected officials. The great thing about this definition is that it also gives us the tools to address equity, right? Poverty, discrimination, access to good jobs, education, housing, safe environments. These are the tools that will impact health outcomes that fundamentally will address equity. And these things are what I would call the social determinants of health, right? And this is the WHO definition. Essentially, the conditions in which people are born, which they grow, work, live, and age, and the wider set of forces and systems that shape one's daily life. what's fascinating about the social determinants of health is that they drive our health. It's not my work as a physician that ultimately drives health, right? I mean, what I do in the hospital, what my colleagues do in their outpatient clinics or in the operating room, really drives only 20% of health. The vast majority of it is what happens in our respective neighborhoods, in our zip code, things that are oftentimes out of our control. So the question is, are we devoting our resources, our time, our efforts into addressing that 80%? Are we stuck on the 20%, which is really not changing much of the outcome? So that's the real question I think policymakers and politicians have yet to really grapple with, for a variety of reasons, which we can get into in the question and answer. But I don't think we're doing the job that we need to be doing, right? So we have the research that says 80% of your health outcomes are derived from these issues, but we're not really giving the resources and paying enough attention to it. This is a graph. Elizabeth Bradley is a scholar. I think she's at Yale now. She speaks a lot and writes a lot about social service spending as a percent of GDP, and really comparing that to healthcare spending as a percent of GDP. And she reports that those countries, particularly in Western Europe and in this country, the ratio from social service spending to healthcare spending, if you are more on the social service spending, you will have better health outcomes, right? You will have longer life expectancies, a decrease in infant mortality. And if you look off this chart here, we haven't gotten the message here in this country. We are still spending significantly more vis-a-vis social service spending when it comes to healthcare. I mean, look at the US. I mean, we're at 16%, 9%. This is a couple of years old, but this drives the point that in this country, vis-a-vis our neighbors and other developed countries, that we are not investing enough, not doing much when it comes to the social service spending, which we know, again, those social determinants of health, which drive health outcomes. So if we believe that health equity or health outcomes, and by extension health equity, is predicated upon the social determinants of health, I guess the question that I asked myself in my own training, in my own research, in my own experiences abroad and in this country and in the hospital is like, what drives these social determinants of health? And I've come to believe over years organizing communities, working in the political sphere, on Beacon Hill in my community, is that something that I call the political determinants of health. And it's a term that I wasn't particularly familiar with up until this past year. And I think I want to credit Daniel Dawes, who writes a fantastic book. And I think, did David Williams give the Hubie Jones lecture a couple years ago? Fantastic book. I highly recommend it. I tore through it. And when I read every page, I was like, that is exactly what I'm feeling, what I'm hearing, and my understanding of it. So what are these political determinants of health? This is a heavy slide with a lot of words here. Could be a bit confusing, but let's break it down here. So the political determinants of health, they really involve this systemic process of structuring relationships, often political in nature, that fundamentally will distribute resources and administer power. And they're operating simultaneously in ways that reinforce or influence one another to shape opportunities that advance or exacerbate health inequities. Systemic process, right? These are deliberative, right? This is systematic. This is, the work that we do in the State House. There is, 100 plus, 200 plus years of doing things and going about it in a very deliberative manner. And it's about relationships that really result in power sharing or not, and giving resources. But I think it's important that we realize that policy can create inequity and it also can create equity. And historically in this country, there's been this tug of war back and forth. We could have a good policy that promotes equity, it's fantastic. But if you read between the lines, if you check out the details, that's not always the case. And so it's important that we understand that and that we always fight to increase more equity in whatever we do. So let's talk about healthcare in this country. Let's talk about the political determinants of health, and let's talk about your role in this. Because I think fundamentally it's about what we're doing. And unfortunately, in my experiences, I don't think we're doing enough. And that's myself, and I put it on everyone, folks in the social service sector, in the medical, we could be doing more. And that's my challenge to each and every one of you today. And that's one that I share with my students, the residents, and my fellow colleagues on Beacon Hill. So this American healthcare system that we are a part of, some would argue that it's a ticking time bomb. I would argue that the bomb's already exploded for the most part. It's more like death by 1,000 cuts. And my concern is that we are lacking a significant amount of urgency in this country, given the disparities that we are seeing and hearing and learning about, or that I'm seeing in the emergency room, that people are literally dying every single day. I mean, I just saw a tweet today referencing an article that I think there were something like 5,000 gun violence related deaths up until April 11th. I mean, that's 50 a day. These are preventable. And there's just a lack of urgency. And for me, as someone who tries to read history, and my concern about the future of this country is, not so much what's going on in the Middle East when it comes to terrorism or other kind of cataclysmic disasters. Obviously, climate change is an important issue, and it is an existential crisis, but so is healthcare. And if we can't pay for the healthcare that we deserve, we will bankrupt this country, and we will be in a more challenged situation moving forward. So this is a graph of life expectancy. And as you can see, things have been rising steadily for about 50 years or so. But over the past couple of years, things haven't been looking too hot, right? And actually, it preceded COVID, actually. Life expectancy has been decreasing in the United States of America for a whole host of reasons. And some would argue it's because of the disparities we see in this country, but also because of things like the opioid epidemic, which I care very much about. Obviously, COVID has played a very challenging role in this. I can't believe I was just talking to someone outside a couple of years ago. I can't believe we've been in this for a couple of years, and as someone who's worked each surge in the hospital, and how each surge was different and challenging, nonetheless resulted in the lives of too many people that could have been saved. We are still in a crisis in this country. But that doesn't also necessarily count for the disparities we see. This is just one graph. It's diabetes, right, across race. Now you could put this graph and you could just change the subtitle: hypertension, obesity, heart disease, stroke, you name it, and there exists fundamental disparities in this country. And I think each and every one of you probably on this virtual call or sitting in person would agree with that situation. And you would also agree that COVID exacerbated that. And I think for many of us, as I was often saying during the pandemic, it really unleashed what many of us kind of already knew what was going on. And over the course of my time in public office, but also in the hospital, was about really elevating and amplifying the concerns and needs of those communities that were hardest hit by COVID, because they were Black, brown, poor immigrants, didn't speak English as a first language. But it was my goal and those of my colleagues and partners to really elevate them and fight for them, because there existed and continue to exist significant disparities and equity issues when it comes to care during the COVID-19 surges. This is a picture of my state rep district. So I live in the South End. Boston Medical Center is down the street from where I live. I represent parts of Fenway, the Back Bay, primarily the South End, also parts of Roxbury. And if I told you that you could walk from Copley Square up by the public library, which I represent, all the way down to Dudley Square, maybe a couple miles, walk at maybe 25, 30 minutes, that there is a 30-year life expectancy difference just because of where you're born. And this is my district. And I think it's a microcosm of what we see in this country. And the fact that I can make that walk, and a walk that actually my wife and I took today with a child from Roxbury to Beacon Hill, it's damning on our city, in our state, in our country. Aside from the moral argument that we should be doing whatever we can to support those most underserved, it's also quite expensive, right? As a policymaker, it's been challenging sometimes when, you try to put on your physician hat, your scientist hat, and you say, well, the data says this, and we should follow that. And you have the moral argument, and you also have the cost-efficient argument, and you still can't get the policy done. Nevertheless, if we do address racial and ethnic disparities, it will also save us money as well, given the fact that our healthcare system is way too costly and way too overburdened at this time. So back to this simple framework that health equity is driven by the social determinants of health, which in turn are driven by these political determinants of health, which we've touched on, explained by Daniel Dawes. So I guess my question, my challenge to you all is, how do we go about getting involved with the political determinants of health, or what have they meant for this country? This is a great quote I found recently about MLK. I think he gave it at Western Michigan University, an address he gave. I just want to read it real quick because I think it really speaks to the importance of getting involved politically to change and shape lives. Now, the other myth that gets around is the idea that legislation cannot really solve the problem. You cannot legislate morals. Well, there's half-truth involved here. But we must go on to say that while it may be true that morality cannot be legislated, behavior can be regulated. It may be true that the law cannot change the heart, but it can restrain the heartless. It may be true that law cannot make a man love me, but it can keep him from lynching me. And I think he understood the importance of getting involved politically and engaging in that work. Because we have some important institutions and players here. You have the White House, you have Capitol, you have Beacon Hill, you have city politics as well. And so often we are so focused on what's happening in DC at the expense of forgetting what's happening in our backyard, the policymakers that you could actually meet with, get a coffee with, that are impacting your daily lives. And there's been a long history of this country with the political determinants of health, sometimes pushing them forward for equity's sake, sometimes not, sometimes passing a policy and then reversing it in a matter of years. So we'll go through a little timeline, just a couple of examples of the political determinants of health shaping the social determinants of health and healthcare in this country that I want to highlight. 1798, John Adams administration, they see that their economic trade is at risk of being decreased because the seamen are getting sick. So the Adams administration puts in a place where we are going to provide essentially health care for our folks at sea. They charge them from their salaries. They put a program in place. They create the Marine Hospital Program that's able to address their needs and concerns, working and to keep the economy running. This ultimately becomes the public health service. Fast forward, 1854, Dorothea Dix, a local person. She was born in Worcester and spent some time growing up, living in Boston, raised here, did a lot of her advocacy work here, was a champion for mental health. Now, she was a longtime believer that we should be supporting suffering from mental health issues, and she supported a bill that essentially would sell 10 million acres to fund essentially what they were, asylums. Obviously we've changed dramatically since those days, but she was a champion of this, and so she put forth this policy that was agreed to in the House of Representatives and the Senate, but we'll talk about what happened to it and why it met some resistance. Powerful piece of legislation that created the Freedmen's Bureau. After the Civil War, Lincoln signs a piece of legislation that some would argue was the most powerful in social determinants of health for some of the most vulnerable people in this country, that is the recently freed slaves. It was a program put forth in '65 that would provide housing, education, food, you name it, to folks that were recently freed. Actually included healthcare as well, but because of racism and because of political issues, they took out healthcare. Fast forward the New Deal. We often sing FDR's praises and all the great legislation he did, which, indeed we can name a couple of them. Social Security, 1935, right? Way for social legislation to move forward in a very powerful way, whether it's the Homeowners Loan Corporation providing funding to increase housing opportunities across the country. Powerful stuff. Harry Truman, he created a piece of legislation that would address food access for children. So many kids were going to school hungry, not able to get care because they were living in food deserts, they were poor, they couldn't afford the food. He creates a piece of legislation that essentially funds public school lunches across this country. One of my favorites, the Great Society. You know, it's amazing in the 60s how we were able to put forth a whole host of policies to address the social determinants of health and the political determinants of health, whether it was civil rights, voting rights, Medicare, Medicaid. LBJ pushed those through. And then obviously the Affordable Care Act, which I think many of us are familiar with over the past 10 plus years. Now, again, remember that tug of war. We push something forward, advance equity for equity's sake, because we believe it is the moral and right thing to do. But it's a lot more challenging than initially anticipated. Dorothea Dix, she gets Senate and the House to agree, but Franklin Pierce vetoes this. He says it's not up to the federal government to address social services, it's up to the states. So he vetoes it. And as a result, for almost 100 years, the federal government is very hesitant to get involved addressing mental health issues because it's a state's issue. Again, 1865, we passed this Freedoms Bureau Act to address these needs for the formerly enslaved. However, they take out health care because it was politically inconvenient to certain racist politicians. Later on, during the presidency of Grant, Grant is a diehard believer in this. He actually advances this moving forward. They create 90 health facilities in the South. They treat up to 10% of the recently enslaved folks. Powerful thing he did. But in 1872, it's dismantled. The New Deal, again, we talked about important pieces of legislation, Social Security, the homeowners loan incorporation. But guess what? The actual text, and understand the political debates at the time, certain policies were exclusionary in nature, right? We'll give you Social Security, but if you're an agricultural worker, domestic worker, you don't have access to it, i.e. if you're a woman or if you're a person of color. The homeowners loan corporation, let's give you funds to buy a house, to rent a house, but if you live in a neighborhood that is Black or brown or poor, let's redline it. President Reagan cuts $4 billion in funding from this piece of legislation, which again allows a private industry to go into schools and not give students the meals, the healthy, nutritious meals that they deserve. And I think we know the most recent attacks on the Affordable Care Act, that was Donald Trump getting rid of the mandate. And the first couple of years of the debate, I feel it was like almost every day the House and Senate Republicans were attempting to take down this piece of legislation. So it goes on to say that we have a long history in this country of trying to push forward the debate and tackling those political determinants of health. And so I want to fast forward into more of the framework that I use, when I'm at home thinking about problems, how do I address them at the policy level as a physician, but also as a policymaker, and something that I've taken with me, even from my days as a Peace Corps volunteer. And a lot of it was actually developed from reading Paul Farmer and understanding, why things are the way they are. So typically we have a problem that we want to solve. You name whatever problem, whether it's food deserts, obesity, diabetes, gun violence, you have solutions that you want to make of this. And so my strategy has always been to ask why this, because I think once you ask that, you begin to decipher, how do we address these solutions? And where do these solutions, where are they going to impact? At what level, right? At the social determinants of health level or at the political determinants of health level. And again, realizing that they are all related. And so we'll go through an example here. So this is a trauma room. This is not my trauma room, but this is one in, I believe it's in Philadelphia. And I apologize if the picture is triggering, but this is something that I've grown accustomed to. This is very similar to my experiences in the emergency department when someone comes in with gun violence. And so I've been at Boston Medical Center for, I guess, 15, and I've been a part of a number of cases in the trauma room where things can get kind of hectic and you do your best to save a life. Sometimes you can't. But it's not all too shocking that over the course of my years there, that the patients I see experiencing gun violence are always, mostly always, from the same demographic. It is always, almost always, a young Black or brown male. And so as you're in the trauma room before this scene unfolds here, and as you get the call from Boston EMS saying that we have, we're coming in 1 to 2 minutes with someone who's been shot in the chest or abdomen, and you go to the room, you have your nursing team there, you have your colleagues, and you're ready to zone in and do the work. and you see a black or brown male, and you're so focused on the medicine that sometimes people just forget about all the external factors at play. And sometimes you debrief afterwards and hopefully do your best to save a life, save the family. Not always the case. But it's not lost upon me that it was always the same type of patient, someone who was poor, black, brown, or male, and didn't really have the opportunities that many of us have had. And it bugs me because it's unfair and it's not right, and we could do more about it. Because when you see these patterns that are consistent and come up, it suggests to me that something is going on here, that there are intentional forces, purposeful forces that are creating this situation. So if you apply a little framework to this, as a policymaker and as someone who's trying to understand, how do I get involved when it comes to gun violence? As a physician, as a social worker, as a policy, you start to ask why. Why do we have gun violence in this country? Is it the culture? Are there too many guns on the street? Are certain communities more violent than others? Or what's driving it? And I think from that, you begin to develop certain solutions. And whether you agree or disagree with solutions, I think it's important that we take into account the wide breadth and the spectrum of ideas that come of this, wherever they may lay in terms of the political spectrum, right? So you have some people say this is an issue of violence. We have to go out there and arrest all these people. And I don't think that's always necessarily the right thing to do, because these folks have been put in situations where they live in communities that are impacted by violence every day, and they're not inherently violent people. Some people would argue from a medical perspective, maybe you can improve your care. Maybe you could have more doctors, more level 1 trauma centers. We have a number of them in Boston. I think arguably we have probably, per square mile, they're probably one of the most in the world. We can start to look at the social determinants of health. And this is why I appreciate working at a place like Boston Medical Center, because they understand this issue and it's a priority for them. There's a program called VIAP, the Violence Intervention Advocacy Program. So this is a team of folks that are with me in the trauma room when things are going down, right? So Rusty, the guy with the Boston Red Sox hat, trauma room is about to go off. Rusty is a trained advocate. There are social workers on this as well. The person behind Rusty is Dr. Thea James, a mentor of mine. She founded this program. We're in the trauma room. We're getting ready to try to save this person's life, and Rusty's in there. Because Rusty knows, just like we all know, that that kid is in there not because he's inherently violent, right? Not because he likes to shoot guns or whatever, but because he didn't have access to an education, because he doesn't have a driver's license, because he can't get a job. So as soon as we stabilize the patient, Rusty's there, trying to provide we have a social worker there as well, the support that he or she needs, and we'll follow them throughout their stay in the hospital and even at home to get them the services they need, because the belief is that they are fundamentally there because of the situation that is happening in their respective communities. Even more upstream, you have places like institutions like the NRA, which are politically potent institution at the federal level, with funding, with advertisement, that have held things up. The idea that the CDC can't do research on violence just drives me bananas. On the other hand, you have places like this state, Massachusetts, where we're able to pass some comprehensive gun reform. Robert DeLeo, the Speaker of the House, sitting behind Deval Patrick, was a real champion of gun violence reform, and they passed a fairly comprehensive bill that did amazing work, really trying to address some of those social determinants of health. And I can say, as a member of the Black and Latino caucus at the State House, we are constantly advocating for more funding and have been very successful with Governor Baker to increase funding that funds programs like VIAP, right? Because we believe it's the social determinants of health that drive that. But that's coming from a conversation at the political level and getting it done with partnerships. So every system is perfectly designed to get the result it gets, right? There are no coincidences in this. There are no coincidences why every gun violence patient I see is poor. It's not a coincidence that my uncle couldn't get the care he needed, and that's why he ultimately passed. The system is designed to get the results it gets. So what levers of power do we have as citizens, as advocates, as academics? I think we have two main ones that I think I want to focus on very briefly. We have the power to vote, right? I think this is obviously, it's understated, this right And in this country where, we don't do enough, that's obviously one which we'll talk about in a second. And then we have government, we have policies, but we also have different levels of government where we need to get more involved with. I mean, I would buy anyone lunch on this virtual call, or anyone here who could name all your city councilors, your mayor, your state rep, your state senator along the line. We don't do enough because we've entered this part in American history, I think, where things are challenging. You watch, the news, folks are fighting, folks are polarizing, and folks have this disdain for politics. But I would argue we need to get more involved, because if you're not leading the conversation, someone else is. And as we saw on the timeline, you might pass a good bill, but those louder voices might be speaking up just a tiny bit more louder than you, resulting in some of those exclusionary policies that we saw. So voting, it's a basic thing, right? You vote, you put in place decision makers. And in fact, in some states, you can actually bypass them with referendums. It's a powerful thing, but the problem is that in this country, we just don't vote. We don't vote enough. We don't vote across the board here, right? We have some folks who work in Vote ER. It's a great program. It's something that I would recommend all folks take a look in. But you should get registered to vote, and you should vote every single election. Voter apathy is on the rise, particularly among minority communities. I'm glad in the State House this past year we passed a vote to significantly expand the franchise. Because if you elect people who look like you, who believe in you, who come from your communities, it is those people that are often putting forth policies and plans to address what. So this is a picture of Ayanna Presley. She's my congresswoman. You can't get on a day of Twitter without her talking about long COVID, maternal mortality, health disparities. She's on it because she believes in it. She understands the community, and she's from the community. So representation matters. Very quickly, just government and policy. Fundamentally, as an elected official, we have government, we have regulations that are put forth to address these issues, and policies essentially codify these things. And it's important that we take into account that what we do in the State House, there's a $50+ billion budget every year, and we'll be voting on it later this month, really decides what gets funded and what doesn't get funded. So we talk about what my role is. You've heard from Dean Delva what I do, but let's talk about what your role is. So I got involved in politics because of this speech here. I think this was the last speech Obama gave before he left the White House. I was in the ICU working, and I got a call that you might be, retiring, which wasn't the case. But he said something on that talk. He said, if you're angry about what you're seeing in your community, if you're tired of it, buy some shoes. Go buy a clipboard and go run for office. And for me, a light bulb just struck. Right? I had been engaged politically before, running for office. I'd been, I was like, well, that's kind of a weird thing to do. But I was like, you know what? I'm going to buy a pair of shoes and I'm going to run for office. And I did it as a third-year medical resident, which is kind of crazy. But I did it, and we won. And but we won because I felt like the community needed their voices heard. I felt like my patients and my neighbors, the issues that they were facing in their community, I wanted to amplify their voices. So I've been in the State House for the past 4 years doing the work here. But this is about what your role is and what you want to do. And I think as social workers, you are in an incredible position to do the work. Incredible position. I have so much respect for your field. The idea that every emergency medicine, every emergency department in this country does not have a social worker there drives me bananas as well. This is a slide from the National Association of Social Workers. I think there's something like 700,000 of them in the country. You are natural, good political candidates. Not suggesting that you should run for office. I welcome that. I would support that. But you're educated. You know what's happening in your community. You believe in this idea that the social determinants of health drive health. And if your voices are more amplified, if you're more engaged with the process, people will listen to you. I know it because they come to my office, they talk to me, they talk to my colleagues, and they move folks. So just to circle back and to close here, we talked about my respect, for Mr. Jones and paying homage to him. And this is a quote we found. It's not only about getting change, but it's also about institutionalizing change, locking change in. Advocacy is not about in one day out of the next. It's 1 month out of the next. The issues we're concerned about mean having a lifetime commitment to children. And I want to recognize that, he He did the individual work. He focused on the social determinants of health, but he went above and beyond that and got involved in the advocacy. So him and his team and his colleagues put out a report, The Way We Go to School. And that report really provided the background and the force behind two important pieces of legislation when it came to special education and bilingual education in this great Commonwealth. So he understood the connection between health equity, the social determinants of health, and the political determinants of health. And we have this example here that we should also cherish and do our best to uphold. I just ask that you guys find your own inspiration. This is my new inspiration and why we're continuing to fight. But it's been an honor to be here to present to you all, and I'm looking forward to having this conversation with you. So thank you very much.
What an inspiring talk. Thank you. And the concept of political determinants of health, I think it just fits so well with some of our work and an understanding of where the social determinants of health come from and eventually how it impacts our everything we do, not just health outcomes, but all types of outcomes. So I wonder if anyone has a question they'd like to start with. I have several, but before I monopolize this conversation, I was wondering if I can open it to our audience. To get us warm up, one of the questions, and you do mention that as a physician, you felt inspired by a particular speech that President Obama gave, but obviously that was something that you had been experiencing for a long time. This calling when you're doing your work as an ER doctor, your prior work, and that sounded like something clicked and you decided, okay, I'm gonna get into the political world. And you mentioned that social workers are perfectly situated to do that, both because of our training and also because our code of ethics calls for us. But in general, we don't have, we're not as involved as perhaps we should. What would be your words of advice for social workers, especially since you've worked with many of them, that you would say might lit up that fire the way yours was lit up?
Yeah, it's a great question. I think that social workers, they enter the field because they feel impassioned by what's happening in their communities, their families, their neighborhoods. And so the inspiration is there, the work ethic is there. Sometimes politically, it's difficult to get engaged because you don't know how. After college, I spent about 5 years abroad, traveling the world, working in different countries and continents. And I moved back to Boston with $70 in my wallet. My family had left the city and I kind of started over. But I had an inkling that I wanted to get involved politically. And so I looked up, politics in Boston. And I started showing up to these meetings. I was that one guy in the back that no one knew. And I just kept on showing up and showing up and showing up. I found out who my local representatives were. I met with them. I talked with them. I saw, hey, what is he or she or they, what are they up to? They're doing the work that I think is important. And I got involved and engaged. And I think that's what's missing sometimes, just to be aware of what's going on. Because I think you will find that you get a couple of people, neighbors in your community, you call your local state representative, and I guarantee you, I hope that they will get back to you soon as not. And if they don't, that's a red flag, right? So getting involved, getting engaged, but I can understand the frustration with the current political scene, the polarization. You watch TV, you're just like, I'm tired of it. But it's now more important than ever to get involved.
Thank you. Before I ask another question that I have, are there any questions from our audience here from Zoom?
Well, actually, I was going to remind all of our Zoom audience members to please type your questions into the Q&A section of Zoom, and we'll be able to answer them for you.
Oh, we have a couple of. Christina, go ahead. Oh, sorry, there's a microphone.
Representative Santiago, thank you so much for your comments. I'm wondering if you could build upon what you were just saying in terms of welcoming people into a conversation, what some tips might be for those who may be on the opposite end of the spectrum and don't agree with what you have to say. You know, how would you welcome them in, call them into a conversation? What tips do you have?
To me, I think it starts with listening, first and foremost. My life experience is we left Boston when I was in grade school, and we actually moved to rural Texas, a place with a couple hundred people, one general store, one Southern Baptist church, politically very different from Boston. And I spent a long time growing up there, and I still interact with both communities, and they're very different. And it can be challenging, right? Because folks are on the different end of the political spectrum. But I think if inherently, if you believe that folks are poisoned or bad people, I think you're not going to do yourself any service here. I'm also in the military, right? I've been deployed. Sometimes across the military, you'll meet a whole host of different perspectives that may be oftentimes more conservative than mine. I try to listen. I try to find some shared value. One of the best experiences of being in the military is that you're often talking to young folks, 18, 19, 20, from all across America, from small towns and cities in the Midwest to farmland. And it's a powerful thing. And you realize that they ultimately care about the same things that you care about, right? They believe and, that they want their family to have access to education and health, that they believe in fairness and justice. But it's about how we get there. And I think if you can find common ground and starting off by listening, I think, you'll have a better opportunity to arrive to some sort of agreement or compromise. But if we start pointing fingers, if we start saying, you're wrong, and we're challenging what they believe and what they know to be right, I think that's where you find the trouble, and that's why the politics can get challenging. Now, it's a challenging situation. I'm not saying politics is that fluffy and fun. You have to have those hard conversations. But I think starting off from listening and engaging and giving people the benefit of the doubt. I mean, I do that in the hospital. When a patient comes in, he's overdosed, 5 times this week. He could walk in there again. I could say, okay, he's an overdose again. Just get him out of here. But to say, hey, he's probably had a lot of trauma in his life or her life. Let me just listen to him a little bit longer.
Yes, we started to receive some questions from our Zoom audience. The first comment is, my niece is about to commence on a path in emergency medicine. She just graduated from med school and has been matched in Tucson, Arizona. Is there any specific advice you would offer to her and you wish someone had advised you? And by the way, congratulations on the newest member of your family.
Thank you very much. Well, congratulations on matching. Matching is the most important day in medical school. It's not graduation. It's match, which is like the second or week in March, where you find out that one place you're going to spend the next 3 or 4 years with. And I remember I was dead set on coming to BU or to BMC, and I got the letter and I was like, wow, this is great. I think my one piece of advice would be to residency is very challenging. It's a lot of hours and you're strained. And at BMC, we try to pride ourselves in the fact that we, have things like we discuss the social determinants of health. We try to invoke those principles in healthcare, but you're so tired, you're so burned out, and you could forget about that. And you could snap at the next patient who comes. And so I think perspective has always kind of been my North Star. And I always try to think about, put myself in that person's shoes, have a little bit more empathy, sleep a lot when you can, take every opportunity to do that. But medicine is such an honor to, when I was in the Peace Corps, I just got tired of being in meetings talking about poverty and health and that sort of thing. And so, someone would show up to my house and I need medical care, and I couldn't do anything with my hands. And so I wanted to be able to touch someone's life. My best friends were like truck drivers and mechanics, and they could do something with their hands. And so that's why I went into medicine, and the power and privilege you have walking into a room, and within 30, 40 seconds, this person is telling you about their life, their challenges. It's a powerful one. I think just to not lose track of that or forget about that privilege.
Thank you. We have another question.
Thank you very much. Excellent and inspiring presentation, and I love your work. And congratulations on new fatherhood. You're just talking about get as much sleep as you can. That's probably the watchword for you right now. You ran for mayor, and to hear you just now talk about the power of physically being able to lay on hands and contribute to saving a life, healing. Can you tell us a little bit about what you were thinking if you had won the mayor's office? Would you have kept practicing medicine on the side, or is this a statement of how much policy matters in terms of its practical impact?
Well, I think ultimately, I mean, if the goal is to save lives, is to improve health outcomes, to increase health equity, I think you got to get involved more upstream, right? You can't just deal with your client on a one-on-one basis. You can't go to the emergency department and take care of the overdose. I mean, there's a role for that. There's an important role for that, the gun violence, and we have folks do that. But we have to ask more for ourselves, and we have to get involved in those upstream, the social determinants of health and the political determinants of health. And so, you know, COVID happens. I'm in my second year in office. I'm still learning how to get around the State House. The Speaker of the House says, hey, this guy looks like he's, you know, knows a little bit about public health. Let's get him involved. He didn't have to do that. You know, State House is a very hierarchical thing, just like academia sometimes in medicine. He welcomes me. We have a small group. And if you can recall the early days of the pandemic, I mean, people were scared to go outside, you know, for valid reasons. But we couldn't even vote as a State House, right? How are you going to pass this important legislation? The economy's, you know, faltering right now. People are getting sick. You need to move forward. So we have to put together a plan to get people to vote, engage, and pass policy. And it was an important lesson in what people can do when they're determined. And I remember early on during COVID, I'd written a couple of Globe op-eds, and the first one was to look at this as an opportunity as well, right? Whether it's passing legislation like telehealth, you know, the voting bill that we passed last month, that really stemmed from the temporary voting bill that we passed during COVID to expand this franchise. And so COVID happens, and you know, the policy is picking up. I'm doubling my shifts in the ER because obviously the healthcare sector is hit hard. And to me, I'm thinking about my uncle, because I'm like, you know, the AIDS epidemic, I always hear the stories about those who worked during the early years of the AIDS epidemic, and it's obviously terribly sad. But I always said to myself, if there was another opportunity to do that, I'm all in, right? I'm young, healthy. And so I worked Friday, Saturday, Sunday, every weekend, overnight shift, and I'd flip. And from Monday through Friday, I'd be daytime in the State House or in the community doing stuff, delivering food, whatever. Flip again. So it's 3-4 for months. Not just COVID, right? Then George Floyd happens, right? You know, we passed police reform. It is an intense time to be involved in politics, to be in this country, but I think it was an opportunity to get involved and engage. And so things kind of died down after that second surge. I actually got deployed for a couple of months to the Middle East, came back in January. The mayor steps down, and I'm like, well, you know, maybe we should give it a shot. You know, yeah, you get a lot of people are calling you, thinking about it. It's kind of you know, you've only been in politics for 2 years, so it's kind of a crazy thing to do politically, but you know, the heck with it. You know, we've always kind of, you know, marched our own beat here. And so we gave it a shot. I learned a lot about the city, myself, and politics tremendously over those months of the campaign. And those lessons will be with me until the day I die. Obviously, we didn't, you know, win. I think if I would have become mayor, I would not have kept the job. But that question was asked like every forum, like, how do you do both? You know, like, I was like, well, I wouldn't do both. When I ran for office the first time, people would often ask, well, can you be a rep and a doctor? And I said, you can, because that's, you know, the lifestyles, and I've obviously been able to prove that. As a mayor, you can't. Mayor is like, you know, 5 jobs all in one, and, you know, you don't sleep at all. So I would have let that go. But I think long term, you know, as I look at my course and trajectory, you know, I don't see myself practicing medicine for the next 20, 30 years. I think it's something that's taught me a lot. It's given me a lot. But I think it's the upstream where we need to get more involved with.
Thank you. So inspiring. So inspiring. Thank you. And I can imagine what it's like to be doing what you were doing, the day shift, the night shift, and then being deployed.
There was
So being a mayor is sort of like, oh, I can do this. Oh, any other additional questions?
Sure. another question from our Zoom audience. Many policymakers often do not work or have never worked with the populations they're creating actual legislation for. How do we change this?
Voting, I mean, it's as simple as that. When you have elected officials who don't represent your values, who don't represent you, the fact of the matter is, because of the apathy that we see, not so many people are deciding these elections. You go look at a Democratic primary, a Republican primary. It's only a few people that really come up to vote, and they're the ones driving the conversation. And so if we got more engaged, but I agree with the premise. The fact is, and I'm kind of old school, I feel like do something with your life, allow that opportunity to give you insight into whatever it may be, and then use that as an engine for passing whatever legislation you deem important. So the work I do at the legislature is really impacted by what I see in the hospital and in my community. I mean, my goal is to really amplify their voices, and I try to do that as comprehensive as I possibly can. And I think whether you're a social worker, physician, lawyer, or whatever, or story from or you grew up in a tough neighborhood and those experiences really shaped your life, to take those experiences with you and become an advocate on Beacon Hill or at the federal level.
Another follow-up question. Just thinking about some of the things you said about positioning social workers to be leaders, political leaders, to be community leaders, is challenging because within the healthcare system, social workers can be one of the lowest paid professions within an interdisciplinary group. And being able to volunteer or spend out of work time, in addition to also being one of the lowest paid groups, makes it very, very challenging. How do we shift this? How do we look at this differently if we've identified a potential solution to understanding?
So I guess the question is a great question. So if we go back to that simple framework, you've laid out the problem on the top corner. It said why, and then you got to ask yourself, what is the political influence of the social worker community on Beacon Hill or on at the federal level? And I guarantee you, if you had 700,000 social workers leading marches, staging protests, there'd be a change. Politics is, it's often a state of inertia. John F. Kennedy wrote a book called The Profiles in Courage, which, was arguably whether he wrote the book or not, but anyway, he's given the credit. It's a Pulitzer Prize winning book, and it follows a couple of senators who made this courageous political decision to do something that was morally right. But the preface of the book talks about why an elected leader votes the way they do, right? And he gives 3 reasons. He says, 1, they vote because they believe in X, Y, or Z personally, individually. Number 2, they represent a community, and the community wants X, Y, or Z to happen, so they're going to vote to represent the community. 3 is kind of political in nature, looking at this future electoral prospects. None of those things talk about evidence, right? So the idea that you can walk into Beacon Hill or whatever with papers and p-values and confidence intervals and they're going to listen to you. The other point is that you're only pushed to do things, right? And so if you're organizing, if you're getting engaged and you're pushing your elected officials to do something and holding them accountable, my guess is that you will get, anything that's ever happened, all those policies that were passed or not passed, that happened because of political influence and someone chose to be engaged and their voices ultimately went out.
Along a similar theme, one of the questions from the Zoom audience was around how politics feels like a very closed system, accessible mostly to attorneys and lobbyists. And it feels like a small club, which is difficult to access. Whether it's advice or a story you can share with us about your own experience, how do you connect and get more involved?
Yeah, I mean, I moved back to Boston with $70 in my wallet. My family had left the whole state. I had an aunt that lived in Bedford, I think. I crashed on my friend's couch. I kind of started over. I mean, I was like, at this time, I was like in my mid-20s. And I just started showing up and getting engaged. And you're right, it seems restricted, the accessibility, and it is. But I believe that, we are, makers of our own destiny, right? You can create that accessibility. If that person shows up with 20 people in his or her community and emails their state rep, I guarantee you they'll get a meeting. If they don't get a meeting, that state rep will be thinking about, or that city council will like, well, are they going to run against me? What should I do, right? And so, and that's my frustration with the political system today. Like, we feel powerless, right? You watch Fox News or wherever, you see, people making decisions that don't align with your values or what this country is supposed to be, and it's frustrating. And if you look at the timeline, that's the history of this country. It's the ups and downs. But I made a decision personally that, I think things can get better, right? I believe in this country. And I remember being in the Peace Corps, and I was reading a lot, and I think I was reading an autobiography on Gandhi, and I was like, well, do you think the world is becoming a better place? If the answer is no, well, then the hell with it. Let's just go make a lot of money. But if the answer is yes, well, you should probably be a part of that change. And not saying that everyone has to be a politician or whatever. Maybe that's just being the best social worker or the best big brother or the best lawyer that you possibly can be. And so I made that decision personally. And for me, I think my skills were most, in my own kind of, I guess, I thought, oh, I could be a good doctor. I'm a decent politician, and those skills would be put to good use. And so, yeah, I think you create accessibility if and you create power. No one's going to give you anything. Unfortunately, that's the hard truth.
Thank you.
Thank you, Representative Santiago. That was a great talk. I just wanted to, I just noted that there's been an increase in voters, particularly among the young. So I think it's gone up to about 50%, which is very encouraging. But I was wondering what you would say to your average teenager, about to vote, to try to get them more engaged, or people in general, because there's such disconnection between lived life and what's happening in the Capitol.
It's challenging, right? We have all kinds of electronic devices that keep us from doing things, and social media. It's quite challenging. I think it starts with developing a culture. Actually, we did like a student government day. Was it last week, Nick, or so? And it was high school students, and they're obviously engaged, and so they're predispositioned to want to vote. And so someone made up. So we were debating a bill that would allow 16 to 17-year-olds the power to vote in municipal elections. And so various students were advocating for it, others against it. And a couple of them said that, it's been shown that if you allow people to vote earlier and get more engaged, that they will have a lifetime of advocacy. And so I think it's about creating a culture, doing that. Obviously, Raphael's 5 weeks old, but he was at the State House with me today. He's going to go to the polls with me, right? And if you talk about the people, the super voters today, like, oh yeah, or people at work that I work with, yeah, I get involved because my mother made me hold signs, and I just create this culture in me, the importance of voting. And I think that is what my goal is we have to get to. And I think at the individual level, is at the household, we're all going to go vote. This is important to us. We're talking about the dinner table. As an elected official, allowing those opportunities to happen, right? Passing legislation that increases the opportunity to vote, mail-in voting, early voting, same-day voting, those types of things. So I think it's twofold, but the challenges are real, and the more that we can create a culture and foster that at the family level, I think the better all will be for it.
Hola, muchas gracias. Thank you so much for this talk. And I think as social workers, we're in a key moment because of the war happening, violence, prejudice about mental health, and stigma around it. And I think one of the challenges is to change narratives, or narratives that don't align with what we believe. For example, a narrative around migrants and what are they doing coming into this country, and negative views about that, while we're working with people that really needs access to care, healthcare, mental health care. So how do you deal with opposing narratives and as us as social workers in that role?
I mean, we see it in medicine too, right? I mean, people say, I mean, you're right. I think it goes to, someone asked a question about that earlier. I think it's about finding common ground. I think, listening, and not listening just for listening's sake, because I think people could sniff through that, right? When you're with the patient and maybe your head's in some other place, and they can sense that you're not listening, you're not engaging with them, you're standing above them, you're not listening to them, you're not actively listening to them. And I think the successes I've had, not policy per se or legislation, but like the individual conversations I've had with people who ideologically are on the opposite side of the spectrum from me. Sometimes we'll just agree to disagree. But I think it's about finding that common ground we have. That, and I learned this during the mayor's race. We have a diverse city historically that is one segregated, different, changing, growing more diverse. Some people didn't want to let go. Some people were scared of that, right? Boston is not Boston from 50 years ago. It's a majority minority city. The values of it have changed. I credit the local politicians. The mayor's doing a fantastic job. But during the race, people were scared about that. And so the conversations I had, I don't care if I was in West Roxbury, something that was traditionally more conservative than JP, or South Boston or East Boston, people wanted the same thing. Like, people wanted a house to live in. People wanted to be able to pay their rent. People wanted to feel safe walking down the street. Like, they wanted the same thing. And so I am a big believer in that we have so much more in common with each other than we think we do, right? But the focus, the media level, sometimes on the social media, that we're so different. I disagree with that premise. I think if we come at it listening earnestly and empathizing, I think we can get to a better place. And you might not always agree, and sometimes I might not be able to convince the patient that, hey, maybe you should stop doing that or this, or to get my elected officials to agree with a certain policy. But I'm a big believer in living to fight another day, not allowing perfection to be the enemy of the good, and to get to some sort of compromise. And I think that's a challenge I think politically exists sometimes. People want the right answer, and they want their policy to go through. And we've lost a sense of compromise. And when the country was built on compromise, right? I mean, you read all those bills. I mean, perhaps the Freedmen Bureau, they took out healthcare because it was either take out healthcare or don't get the bill passed, right? And let's miss out on all these things. And you might get attacked by your ultra progressive friends because you gave up on that. But I think in the moment, taking into account the internal and the external pressures and the political calculations and what's at stake here, I think it's teach their own to kind of come up with their own decision making and determine if it's okay with their values.
Thank you. I think we had another question.
You touched on this just now, but it seems to me that politics and government in general has an image problem. And I wonder how you feel about that. To what extent do you think that image problem is recognized at various levels of government, and what, if anything, is being done or can be done about it? I think the engagement issue, I think, turns quite a lot on people's general sense of how effective government is. And to the extent the image can be improved, I think engagement is likely to follow.
Yeah. I mean, there's the metaphorical image, but there's also the actual physical image, right? I mean, when people look at an institution that doesn't reflect them, or historically hasn't reflected them, or historically has put up policies that has endangered their community, or put them in a position where they've had less power relative to the folks in power, I wouldn't trust them either. I'd be scared of them. And that's why it's important that you look at the folks that are championing equity, and those are the people that are coming from those communities, and that's why it's important to elect them. Government can feel like an insular thing sometimes, right? You go to your meetings, the lobbyists or the people in your community are telling you what you want to hear sometimes. Okay, am I always really right? No, and so it's important that I have a healthy set of friends and colleagues that can speak truth to power sometimes. But I would agree with that assessment that there is an image problem that needs to be rectified. And I just can't go back to, this issue of voting and getting active and getting engaged, because, I'm not in this position I am today because, it's coincidence, right? People before me, pushed for immigrants, people of color in position. And I can literally go to my personal history and see, an experience and opportunity that I got because someone like a Hubie Jones put an opportunity there. And so I think, my goal is to continue to do that for the next generation of folks, with the goal that in those positions of power, that image issue becomes more reflective of the people on the ground. Because I get frustrated with DC as well, and Beacon Hill and City Hall. I wish things would move faster. Some people wish they would move slower. Some people wish that we would pursue certain policies. But that's the battle of democracy, right? And if this was easy, we'd all have all the answers. But again, the louder your voices are, the more likely you are to change things for the better.
Thank you. We have another question from our Zoom audience. Deborah Prothow-Stith identified violence as a health issue in the 1980s. How do you feel, or how do you feel we have progressed or regressed from that construct?
Well, yeah, I quoted a stat earlier. I think I read that something like 5,000 people had died from gun violence from January 1st to April 11th, 50 a day. I mean, I see it. I worked Friday, Saturday, Sunday, this shift in the emergency department. I saw my fair share of violence. People were stabbed, shot. As a physician, you do the job of taking care of folks. The power of institutions like the NRA is what concerns me, right? They've created a narrative where they've essentially got half the country, or half the voting country at least sometimes, and giving them a lot of power. And so, the idea that, for example, that the CDC can't do research is mind-boggling. I mean, I understand why, because again, the politics at play here. But so my goal is to really just to show that violence is not so much, again, like that chart was saying, it's not a result because people are inherently violent or communities are inherently violent, but it's the situation in their respective communities that result in that. And so are we regressing? Are we progressing? I see both ways sometimes. On the whole, I don't think we're doing very well. I think every other day I read something about gun violence that really disturbs me, whether it's in a school, whether it's in San Diego or wherever that was in California recently. And so I don't think we're making much headway. I think there's some significant political obstacles in DC driven by an industry and lobbyists that I disagree with, that is concerning. So all I can do is continue to push the fight at the local end, right? You saw DC might be stagnant, whether that's gun violence, whether that's passing a COVID bill. The state of Massachusetts, just 2 weeks ago, we passed a supplemental budget, which include a significant amount of money for COVID funding. And so things can happen at the local level, right? These local city, state governments, they serve as models. I mean, you look at the state of Massachusetts, the Commonwealth, whether it was gay marriage, whether it was healthcare, none of these were perfect, right? But they created a model, and we're building on this. And I think the more that we can do that at the local level, and have the results and the outcomes that we want, I think the more people will buy into it.
Thank you. Another question. There are significant power disparities between social workers and physicians in hospitals. How do you navigate power dynamics with your social work colleagues to create a climate of respect and collaboration that can be so important in influencing whether people want to get involved in political change?
Great question. Sometimes the internal politics of the working place kind of take over, in some ways good, some ways bad. I feel lucky at a place that, it's a collegial environment. I wish we had a full-time social worker 24/7. I can't tell you. In fact, this morning, I sent out a patient at 7 o'clock in the morning because I worked overnight, and was like, "Hey, nothing much else to do medically. Need a social worker, but he's not coming in until 8 o'clock. So if we had a social worker at night, maybe all the work could have been done, could have saved the patient being in the emergency department, could have saved the potential admission, which is money, which is a potential, he getting sick with COVID or, in the hospital. So I think personally that we should be investing more in the field, educating more social workers, paying them more, providing more opportunities, because what I do at Boston Medical Center, in my job as an ER physician, folks aren't there for medical issues. I mean, they are there, but many of the issues are the social issues. And social workers are educated and trained to deal with them in a more comprehensive manner than their ER doctor running around from pneumonia to gun violence to whatever. And so I've long time been a champion of social workers being in the emergency department, and I have tremendous respect for them. And again, when the trauma room happens, I might be in there leading the operation, but an important part of that team is Rusty from VIAP and the social worker. Literally, once the person is medically stabilized, social worker goes in there. Who is your family? Can we contact them? How can we help you? Rusty's helping out over the course of their admission. How do we get you the education, the services that you need to get you out of the situation that brought you here in the first place?
Thank you.
Since you're not getting inundated, I'll ask another one. Mass General Brigham was just repulsed on its effort to build 3 large ambulatory or service centers out in the suburbs, play for more patients and more wealth. Supposedly the Affordable Care Act is driving care upstream. And I wonder, what do you see the prospects in the next round of state healthcare reform for including some kind of a measure, some kind of a measurable report card, if you will, on the performance of our healthcare providers, notably large ones like Mass General Brigham, on concrete efforts to drive care upstream, investment in community health workers and social workers, using their capital projects to invest in women and minority-owned construction firms, contracting out their vending services to locally owned companies, supporting community organizing in their communities, supporting legislation to address the politics of determinants of health. Could we get that in state legislation, requiring these institutions to have to report on those kinds of measures?
I'm sure you could pass a law to do a whole host of things and to require folks and predicate funding on certain or incentivize for sure. When I look at institutions like MGB and all the academic medical centers across Boston, across the Commonwealth, they play an important role. You look at MGB's attempt to increase services in Worcester County and Middlemass. I mean, we passed a bill in the State House that kind of pushed back on that, right? And said we were concerned that they would drive up costs, right? I mean, we have here, as much as I love our healthcare system and a part of it, obviously there are some disparities and some issues, and I agree with wholeheartedly with the desire to address more upstream issues. It's expensive, and are we getting the care and the outcomes that we deserve? I will say that legislation was passed, I want to say in the past 10 years, to create things like the HPC, Health Policy Commission, to create CHIA, Center for Health Information and Analysis. And they have grown those institutions statutorily more in power over the past couple of years. And as you probably have read, they put out reports suggesting that, listen, if you want, your desire to expand out to Central Mass is going to result in an increased healthcare expenditure up to, I think it was in the maybe $56 million. I'm not sure what the number was. But those are raising red flags for us, right? So we've put into legislation these institutions, which I might add, first in the country to do this, and other states are taking note of this and passing legislation to do similar things, to have kind of an independent body say, let's analyze the data, let's be as data-driven as possible, which is not a thing that politicians always like to do, right? You know, I wear a hat as a physician scientist where my practice is theoretically dedicated to, you know, science and the scientific method. And when I present as a resident or when I have residents present to me, it's always based traditionally on science, right? Like, you know, study X shows that we should do this, let's pursue that. In the political sphere, it's not like that at all. If I showed up to a legislative debate and I came with all my studies from this journal or that journal, it's just gonna go like this, right? Politics is much more of an emotional thing, right? So when I try to get a point across at the political level, I tell the story of one patient, a patient who came in, who couldn't afford the diabetic medication, got DKA, a complication from diabetes, was in the hospital, almost died in the ICU because he couldn't afford his insulin or because he was rationing, because it was too expensive, right? That argument would fail in the hospital. Like if a resident said, oh, we should do this because I had one patient last week who did that, like as attending, I'd be like, that's not how it works here. So there are different worlds and there are different mechanisms that you need to use to be successful. Again, the political one is much more emotional. And so that's why the importance of storytelling is more important there. But I think if you look at HPC, I mean, look at, you know, pharmaceutical drug costs, you know, through the roof. Fed's trying to do it. We have a bill right now that passed the Senate. It's in the House, and, you know, we'll see what happens moving forward. But the bill is looking at using the HPC and Center of Health Information and Analytics to determine whether these, you know, pharmaceutical companies are you know, doing their due diligence, not marking up the rate for just you know, just for profit. And so we'll see what happens ultimately this year. But those are the types of bills in conjunction with working with organizations like the HPC and CHA. That's what they have the power to do.
Thank you. And thank you. That's incredible discussion and insights. I appreciate that. I think we're gotten to the part where Ellie Zambrano is going to help us close. And I didn't realize you had an overnight shift. So you've been going there for a long time.
Oh, I'm used to it now. So plenty of energy. You can ask Nick. We just sleep, get up, and you put one foot in front of the other and get to work. So.
Thank you, Ellie.
Well, first I want to thank you. Thank you so very much, Representative Santiago and Dean Delva. We appreciate you sharing your valuable time and tremendous insights with us tonight. Thank you for inspiring us with your innovative work. In honor of Hubie Jones's legacy, we encourage friends and family, alumni to donate to the Hubie Jones Fund for Urban Social Work Practice. Your support will help fund scholarships that help deserving students pursue a MSW degree, as well as research and programs supporting the intersection of social work and health. To make a donation, please visit our website. Before closing for the evening, I just want to take a moment to thank the marketing and communications team at the center and the School of Social Work for their leadership in organizing tonight's event, to Kate DeForest and her development and alumni relations team, and to the entire staff at the Center for Innovation in Social Work and Health, especially the volunteers that came tonight. We hope that the information from today's presentation can help all of us take additional action in our work to advance health equity. Thank you very much.